Alright, so I come to the door and do my general survey. I don't see anything harmful, no tripping hazards, no puddles, no blood or urine on the floor. Everything is good. My patient looks awake and alert, and she looks comfortable and okay. Everything looks safe for me to enter. What's your last name? Have you watched Doctor House? No, it definitely is. Okay. Hello, Miss House. How are you doing today? How are you? Awesome. I'm good. I'm gonna close the for hand hygiene. Where are you at today? The hospital. Awesome. And what year is it? And why are you here?
Negative for hepatitis.
Awesome. Can I see
Now
your
I'm gonna test your spleen.
Can you see your first name
right here?
And your last name?
I'm gonna find the
Date of birth?
11/21/2015.
Everything looks good. Do you have any allergies?
Okay, perfect.
Great. Any allergy bands, and you're not allergic to any latex or anything?
Can I help you sit up?
Okay, great. So, my patient is awake, alert, and oriented times 4, and she doesn't have any allergies. Everything looks good. And do you have any concerns before we get started?
In my right arm.
Oh no, I'm so sorry. Good job. So it's in your left arm. Is there any certain place or all over?
Do you want that?
Yes. In your elbow. Okay. When did this pain begin? Oh, I'm so sorry. And did you do something that made the pain happen?
I hit it on the nose.
Oh my goodness, I'm so sorry. And do you do anything that makes the pain feel better? Okay, that's good. And do you do anything that makes the pain worse? Okay, pressure. I'm gonna try to avoid putting pressure on your elbow. And does the pain radiate or does it just stay in your elbow? Okay, so is it okay if we continue with this assessment? Awesome, and I'll let the doctor know to try to get you something to help with your pain after this, okay? I'll try to avoid this and make sure you're comfortable. If you have any pain, let me know. Alright, we're gonna start with hair and skin. Is it okay if I assess your scalp and touch it? Okay. Alright, so I'm just gonna feel around. The hair looks healthy and clean. I don't feel any bumps or lesions, or I don't see any edema or ridges. I don't see any roots or my hair, which is good. I'm checking the areas of the lobe, and I don't see redness or redness on the shoulders or scapulars, or no redness here, no redness on the elbows, no redness on your heels, which is good. No edema on your feet. Oh, right, so that's awesome. And if I would have seen edema, I would have seen if it's blanchable or non-blanchable. Blanchable means when I press it, it turns white and then come back to red. But you don't have any, so that's good. Alright, now I'm going to feel for warmth and dryness. Bilaterally all the way down and then down your chest.
What kind of pain is it?
Alright. Bilateral warmth and dryness, which is good. And now I'm going to check for your capillary reflow on your toes. I'm going to push down and then come back within 3 seconds, which is good.
And then I'll
Move
have
your
you
fingers.
so I can listen to the
And then come back within 2 seconds, which is normal finding or negative for that.
Skip that and listen to your carotid. So
And I don't see any edema or swelling on your feet. If I did see, I already talked about that. Or if I did see edema, I'd see if it's hitting and non-hitting, and that means when I press it down, it wouldn't come back up. But you don't have any of that, so that's good. Alright, now we're going to check for clubbing. If you could just put your fingers together like this. Alright, awesome. So I see a little diamond, which means you're negative for clubbing. If you did have clubbing, it would be a sign of long-term low oxygen levels. Alright, now I'm going to check for tinting, and this checks for good elasticity and hydration. Alright, you bounced back real good, so you're negative for tinting. Do you have any moles you'd like me to look at? Okay, awesome. So this mole is symmetric, which is good. The borders are well defined. The color is brown, has always been brown. Awesome. And the diameter is less than a pencil eraser, which is good. I'm just gonna feel. It's not elevated. That's good. Has it evolved ever? Has it changed? No. That's good. Alright, and it's flat as it felt, and has it grown at all? Awesome. So I don't see anything anything that causes for concern, but if you do have concern, I would recommend going to your dermatologist and having them look at it.
On top of your foot.
Okay, do you have any further questions about your skin before I move on? No. Alright, so now we're gonna move on to respiratory. And as we move back here, I'm checking AP lateral 1 to 2, which is good. She's negative for a barrel chest. And next one. Alright, now I'm gonna feel down your spine. If you could just hunch your shoulders over and bend a little bit. If you have any pain at any time, just let me know.
I do see a diamond, so that means you don't have
Any pain? So
so
good.
check that. I'm gonna
Great.
listen to it, but I actually use the
Hear any pain? Alright, we have negative for saprolactin, which is good. Alright, can you point to your last rib for me, Miss House?
I'm gonna check
Awesome.
for symmetry. It looks like
Alright, so let me know if you have any pain, okay?
I'm gonna check the border. It's a very
Any pain?
prominent border. It's not like fading into anything. I'm gonna check the color. It's
Any
light
pain?
brown. Has it changed at all?
Great. Alright, so you're negative for kidney or CBA tendons.
I'm not elevated.
Alright, now I'm going
looked at all.
to and I'm gonna have you take a series of 10 deep breaths. If you get tired at all or you need to stop, just let me know and we can take a break. Okay?
If you want to get it checked out, you can.
Alright, so I'm gonna put my stethoscope in the right way. Make sure it's on. Yep. Alright, so I'm gonna start at your 10th breath. And then when I put my stethoscope on, you're just gonna take a big deep breath through your mouth and out through your mouth. And then when I move on another side, you just take another deep breath. Okay? Okay, go ahead.
and I can help you up now.
First, I'm gonna check for you. Go ahead. Tell me if you have any pain.
Awesome. Alright, now just for time, I'm going to demonstrate where I would place the other places. And in real, you would take deep breaths for all of these. Okay, now I'm going to 6.
Okay, I'm gonna check your sacroiliac joint.
Pain?
Okay, so you can negative.
And you're awesome.
Just negative.
And then if you can put your arms out like airplane for me. And mid-axillary.
Okay, so now I'm going to.
Alright, all lung sounds are clear to auscultation, which is good. Now I'm going to go on to palpation. We're going to check for your chest expansion. I'm just going to grab your chest nice and firm, and you're going to take a big deep breath for me, okay? Through your mouth and out your mouth. Alright, go ahead.
So you're negative for CVA or kidney tenderness.
Alright, and as you did that, I watched my hands rise and fall symmetrically, which you are negative for pneumothorax. Great, now we're going to test for tactile phrenesis.
Okay, yeah, because that's how we.
And as I put my hands on your back, you're going to say 99, nice and loud for me, okay? Alright, I'm going to start on the 10th. Ready? Go ahead.
Okay, so I'm going to start at each hand.
6, go ahead. And 7, go ahead. 99. And put out like airplane. Great, it all sounded good. No, you're negative for consolidation, and I felt the vibrations equally with the ulnar part of my hand. Okay, now we're gonna start with percussion.
Make sure you never go diagonal. Remember? You always
Yeah.
go diagonal. Yeah, you did.
Okay.
And then put your arms up.
And then we just have to write on a sheet of paper.
And if it wasn't so loud in here, I would be able to hear.
Okay. Okay, next, are you going to feel me squeeze?
Oh, that one was
And then
actually.
you're going to take a big breath for me. Okay, it is bilaterally symmetrical. So it
And put
is
your hands like
negative for
airplane.
thorax. Okay. Okay, next you're going to say 99.
Awesome. So we had some resonant sounds which indicate
99.
good aeration. We had no
99.
hyper or hyperresonance,
99.
which is a good indication, which would indicate consolidation or hyperinflation, which is good. You don't have
Your
that.
resonance is
Alright.
bilaterally equal.
Now we're gonna move to the
Okay,
front.
negative for consolidation.
Then we're gonna check your
Okay,
right middle
now
lobe.
Okay.
I'm gonna auscultate because you can only get the right middle lobe from the front.
How are you doing today? Good.
Alright, I'm just
Alright, my
gonna
name is Jawira. I'm a student.
feel your clavicle.
Nursing student at Palm Beach Atlantic University. Okay. do an assessment today on you, okay? Are you in any pain today?
And breathe in.
Where are you?
Awesome. And breathe in.
I'm at the hospital. Just for the hypo.
Why are you here?
I didn't hear anything for resident.
Clear, great. Clear for auscultation for right middle left. Okay. All right, now we're gonna move on to cardiac.
Right middle.
Okay.
Can you guys take a deep breath?
Oh no, we can start up. Okay.
Oh.
Okay, so now you can just say calm and breathe normal. I'm gonna be listening to your heart.
Alright, I'm gonna go ahead. Oh, you know what? I'm gonna provide
Okay, I'm gonna start with your aortic.
Okay, I'm just gonna verify your ID bit. Restart this whole thing.
Pulmonic.
I'm sorry, so yeah, I didn't wanna waste your time, girl.
Second pulmonic.
Okay, we're practicing Saturday.
Yeah, Saturday morning. Early morning.
6 o'clock.
What happened to 4 o'clock?
Oh yeah, 4 o'clock. We can do 4 o'clock.
And then if you could just raise this arm up.
Yeah, 4 o'clock.
Okay, sorry.
Okay.
Okay.
I'm gonna start on your cardiac.
Awesome. So everything sounds great.
Is not in the tripod position.
I don't know if you're sitting here.
The color of my t-shirt.
Oh wait, and then I need to do the bell.
Well, for her ethnicity. So I'm gonna go ahead and proceed.
All right, if you could lift your arm up one more time. All right.
Oh.
Awesome. You can put down.
I'm good.
I realized yesterday no one do that.
That's how they are at the doctors.
Whenever they lay down, just pull that out from there. Like not dangling, okay? That's for when she lays down, okay?
Good.
Okay.
Okay. And I heard S1 and S2. I heard S2 best at the aortic and pulmonic, S1 louder at your triphenoid and bicuspid. And the mitral valve is where I would listen for apical pulse and palpate for TMI. There's nothing abnormal heard like S3 or S4 or murmur or rab, which is good. All right, now I'm gonna have you lay down and I'm gonna listen again.
Your eyelash. Okay. Can you tell me a little bit more about that?
What?
Yeah, I just started. Okay. What
Okay.
type of pain is it? Is it like a achy pain, sharp pain?
Okay, so I would listen again, but for the sake of time, I'm just going to pretend.
So, what's so ridiculous? I'm so funny, girl. Alright, sorry that's happening, okay?
Alright,
So
now
I'm
I'm going to move to the arteries.
Go ahead and get your eyelashes, okay?
So I'm gonna first listen to your arteries so I don't.
Go behind, okay? We're gonna begin if that's okay, okay?
And I'm gonna have you lay down.
Okay.
And I listen to your arteries.
Okay, so I see that your hair is full and it's thick.
Now
There's
I'm
no
going to
lesions,
Great.
no
arteries.
Now if you could come to your sternum.
at the bottom of your neck,
Listen to your
there's no and no nits.
Awesome, and then if you
Now I'm
can
gonna check your bone prominences, which the first one would be right here on the occipital, your shoulders, your
This is what you asked me to state for me. And I'm gonna hear you brewing, so that's good.
the spine,
Can you
your
put it in the
scapula,
video?
go down to your sacrum,
That was when I did the 4.6.
Did you do renal?
elbows, and then your heels. And while I'm down here, I'm gonna just lift up your feet, just check for any
We'll write that down.
Pretend.
anything. Next thing, I'm gonna go ahead and do the temperature, okay?
Which is here, right?
So I'm gonna go ahead and then go down.
Alright, we didn't hear any bruise, which was good. Now since I didn't hear any bruise, it's safe for me to palpate.
I'm gonna
You're warm and dry,
Alright, so now I'm gonna
which
feel
is
for
good.
your
Next, I am.
Do it one at a
you're gonna
time
go
so I
ahead
don't
and
kill
do your
you.
fingers like this for me.
Alright, and that's gonna be +3, which is good. And if I can feel your.
Like this. And perfect. I see a little diamond.
Alright, your
which means
radial
that
or
you have
bilateral
pressure in your
+3.
belly.
And now I'm gonna state femoral and
Next,
state
I'm gonna go ahead.
popliteal
This is called
and do your
tenting.
posterior.
So I'm just gonna squeeze your forearm like that. Perfect.
And that's
And your skin
+2.
is coming back, which means that you have
Plus
elasticity,
which is
and you're
good.
hydrated, which is good.
Alright, now we're gonna move on to abdomen. Alright, your abdomen is flat. I don't see any striae or piercings or tattoos or hernias. If I did, I would document. Alright, now I move on to auscultation, but I already listened to your abdomen while I was listening to your arteries, and I could hear your abdomen working, so we can skip that.
I can feel it.
But if I did, I would start in the right lower quadrant, right upper, left upper. Okay, now percussion. So, can you tell me where your belly button is? Alright, and I'm going to draw an imaginary line to the quadrants. And listening for things.
Oh, I'm like, that seems like a long ways.
Tell me if you have any pain.
Alright, your tympani throughout your abdomen, so that's good. Alright, now I'm going to palpate, and I'm going to test for pain and tenderness. So, anytime you have any pain, just let me know.
When we do these palpations.
Alright, so first we'll do legs.
C
Great. So now I'm going to do a seat palpation. I'm just going to push down and draw.
D is which is less than
Okay, hold on.
I'm not feeling massive. Alright, I have no helpful findings, which is normal.
Yeah.
Now we're going to do a special palpation, which is a spleen and liver. Okay, so I'm going to use the technique to release spleen. I'm going to put my fingers under your ribs, and I'm going to have you take a big deep breath. And when I do, I'm going to get in there.
which
Alright.
also, like I said,
Ready?
is
Take a big deep breath.
and it hasn't been any growth.
Awesome. Good job.
So
Alright.
if
So I didn't feel your liver, which is good. We don't have inflamed liver. Okay.
Next, I'm gonna test the.
So now I'm gonna test your liver.
So
I'm gonna do the same thing over here though. Okay.
Take a big breath in.
Ready? Big breath in.
alright. What you're gonna do
Awesome. I didn't feel anything, so you're negative for your measures. Alright, so you can go ahead and sit up. Okay, and complete. Do you have any questions? Awesome.